Um, which of the following which of the following is most likely cause of her symptoms? Okay. Seems to be like a neuro question. 55-year-old woman with 3-day history of dizziness, nausea, and vomiting. She describes dizziness as spinning and is worsened with head movements. On examination, she has horizontal nystagmus that changes direction with gaze and a negative Romberg test. She also has difficulty walking a straight line. Okay. Let's see, dizziness and spinning. So I know that they're all on here. So vertigo's on here, Meniere's disease is on here. Cerebellar. Okay. Let's see. Vestibular neuritis. Dizziness and spinning is worsened with head movements. Changes direction, most likely cause of her symptoms. Okay, don't like acoustic neuroma.
Okay.
Um, Cerebellar infarction, I don't like either, even though there's some cerebellum issues here, but it just doesn't seem to fit. Um, I can't remember the definition for benign proximal positional vertigo. And Meniere's disease, I'm trying to think if there's something with audio. I just can't remember which one it is. If it's Meniere's or if it's positional vertigo. I would go with vertigo, even though I'm with A here, but I'm not confident.
Okay. Let's talk about this. Okay,
Okay.
so um ENT question. Okay, we get
Okay.
asked about dizziness quite a lot, so I'll work you through this here. So benign paroxysmal positional vertigo. Okay, so a couple things to kind of differentiate with nystagmus. Okay, just on a broad sense, there's central reasons for nystagmus, meaning more brain things, right? And peripheral. Peripheral is like where the nerve comes out, right? Anywhere
Okay.
along that's considered peripheral, like CNS. Okay.
Okay.
Um, so once you've kind of figured that out, okay, so you have two subsections there, but let's talk about mainly the peripheral one, which is an ENT standpoint. What I care about, the central stuff, is more kind of the neurologist standpoint.
Okay.
But on a central standpoint, you have a couple things. Okay, you have BPPV. Okay, benign paroxysmal positional vertigo. So meaning benign, meaning it's not malignant, right? It's just
Right.
kind of nothing super horrible. Paroxysmal means kind of like, in and out. It doesn't happen for a long period of time. It's positional. Okay. That's really kind of what it means.
Okay.
So that usually lasts only like, up to like 2 minutes. So it's very short. Okay. Very
Okay.
short burst of vertigo. Okay. And usually what happens is it gets triggered by head movement.
Okay.
Okay. And the pathomechanism of it is because the otoliths are in a incorrect spot. Okay, they're stuck somewhere they're not supposed to be.
Okay.
Okay, and so you have something to diagnose it, which is called the Dix-Hallpike maneuver, and then you have something to fix it, which is called the Epley maneuver. Okay, that's a little bit more for your test that you don't really need to know, but just giving you the full picture here.
Okay.
So she has a 3-day history of this, and so it's a prolonged, like in the vertigo nystagmus world, that's a very long time. 3 days is a long time. Okay,
Okay. So they're
so
normally, like you said, they're only a few minutes long.
yeah, they lasted every 1 to 2 minutes, right? Sometimes a
Okay.
couple seconds, and it usually goes away until you have a head movement in that same direction. Okay,
Okay.
so unlikely here. Meniere's disease, okay, can last this long. Okay, can last hours with an S. Okay, vertigo that lasts hours. Okay, but it usually the symptoms of vertigo happen and it's usually episodic and it happens concurrently usually with hearing loss, so you have to have some kind of history of hearing loss, and usually they have a history of either family history of Meniere's disease or a history in general in the past that they've had episodes like this before where they've had loud roaring, hearing loss, then all of a sudden vertigo for hours. That's Meniere syndrome, but there's no hearing issues here, there's nothing like that, so unlikely Meniere's. Okay, vestibular neuronitis. Okay, so you have things that how do I say this? it's part of the diseases that have inciting events. You know how I always talk about inciting events, right? Where
Mhm.
you either have a viral infection or trauma or something significant, and then it cascades to another disease. So vestibular neuronitis is usually when you have some kind of upper respiratory infection. Sometimes they mention it, sometimes they don't.
Okay.
Or that it affects practically your immune system overreacts and it attacks your vestibular nerve.
Okay.
Okay. So your vestibular nerve, which is part of cranial nerve 8, right? You have your cochlear vestibular nerve, right? So just the vestibular portion, it attacks it, inflames it. And when it gets inflamed, you can have days of vertigo. It's absolutely miserable.
Okay.
Okay. So which is what this patient has, which is absolutely miserable. Okay.
Okay.
Cerebellar infarction, right? Usually they're going to give you a little bit more, right? It's a stroke, but your cerebellum, you get ataxia and things like that.
Mhm.
That's a central, right, issue. And usually I think vertigo for central is usually, I think it's vertigo nystagmus, if I'm not mistaken. Um, Nystagmus that doesn't change with gaze,
Okay.
uses central and location, but usually it's up and down vertigo, I'm pretty sure.
Okay.
Acoustic neuroma, right? That's more of a chronic thing. You can get vertigo with this. You also usually get hearing loss with this.
Yep.
The tumor is like a schwannoma, right? And so it
Yes.
compresses both, the cochlear and vestibular nerve, right?
So like
So
7
unlike
and 8, right? Or no,
usually just 8, but
8.
it can compress 7 too if it gets big
Okay.
enough.
Okay.
But yeah, so best picture here is going to be vestibular neuronitis because the duration of it, right, happens for days and things like that. But
Okay.
it can change with direction of gaze because this is a peripheral. And I want to mention one more thing about nystagmus and vertigo, is labyrinthitis, okay, which is
Okay.
inflammation of the nerves in the labyrinth of the internal auditory canal, right? The labyrinth segment of kind of where the nerves go through.
Okay.
And the reason why is because there's a slight difference. Labyrinthitis will also affect the hearing nerve, like all of cranial nerve 8. Okay.
Okay.
So they'll have the dizziness just like this, but they'll also have hearing loss.
So it seems like Meniere's is going to be hearing loss, like you said. Is that
Episodic.
hours or day hours?
Yeah, hours.
Episodic.
Hours.
So
Yeah.
regular beep, like benign paroxysmal positional vertigo. That's just quick minutes,
Yep.
um, and that's just based on, like you said, the otoliths.
Yep.
The cerebellar infarction. There's almost not enough cerebellar symptoms in this
Yep.
case, so I understand that one. And then acoustic neuroma, I remember with schwannomas, and
Yeah.
cranial rape. So then vestibular neuritis, which I wasn't sure what that was. So these are all horizontal nystagmus, and then that one's going to be the days, like you said, and it's
Yeah.
just
Yep. And
in the nerve part. Like I'm confused on, um, so it's just inflammation of that nerve, and that's it.
yeah, it's inflammation, right? It's inflammation of the vestibular portion of the cochlear vestibular nerve, which is cranial nerve
Okay.
8. Because the cochlear vestibular nerve, it's kind of new two nerves shoved into one. But when it says vestibular neuronitis, it's just particularly the vestibular side. Okay.
Okay.
The reason why I'm making a big deal about that is because there's another diagnosis that they could test you on, unlikely, but it's called labyrinthitis.
Okay.
Okay. Labyrinthitis is this all of cranial nerve 8. So you're going to have hearing loss and vertigo symptoms that can last for days.
Okay.
You
Okay.
understand? You know what I'm saying? So this has no
Okay.
hearing. So I know for sure it's vestibular nerve 8.
Gotcha.
But if they're
Okay.
like, oh, 3-day history of dizziness and cannot hear from that same side, then I know it's labyrinthitis.
Okay. With
Okay.
the same, otherwise same presentation.
Yes.
Okay.
Otherwise, in presentation.